We're just waiting for the Facebook Live link to pop up and then we'll start. Okay, good evening, everyone, and welcome to this afternoon session called Nourish You, PCOS and Caribbean Diets. And just from the title alone, you know that we are going to have a very informative session on how we can nourish our bodies with PCOS while still enjoying some of our local cultural foods. And joining us today to conduct this session is Tessa Hampton, RD. She is a registered dietitian with a BSc Honors in Human Nutrition and Dietetics and a diploma in Institutional and Community Nutrition and Dietetics from the University of the West Indies. She is passionate about showing others how local cultural foods can fit in a healthy diet while simultaneously improving existing medical conditions. In her private practice, she specializes in helping adults achieve weight management and control of conditions such as diabetes, hypertension, cardiovascular disease, high cholesterol, hormonal imbalances, and of course, polycystic ovarian syndrome. We welcome you, Tessa, and the floor is all yours.
Thank you. So I'm glad to be here as part of September's PCOS Awareness Month. So compared to what we know now, I would say as to 20 to 30 years ago is a lot more. And people have come to realize that it can be sort of classified in one of those invisible illnesses. So by that, I mean, we know that PCOS has physical symptoms, but it also has other symptoms that may not show up physically for someone, or it may be that it takes very long to get a diagnosis. So I don't know if any of you know anybody who took a long time to become diagnosed with PCOS, but it can take a while. So I am going to share my screen and we're going to go through like a presentation that I have done on this entire topic. All right, so just give me like a minute. Okay, so just making sure everybody else can hear me because I think I saw all the speakers were off, all the microphones.
We can see and hear.
Okay, good, perfect. All right, so today, as we said, we're going through polycystic ovarian syndrome or PCOS and how this applies to the Caribbean diet, seeing that our diet is different from the diet that has been studied, which is the Mediterranean, and that is the diet that is mostly pushed when it is somebody has a hormonal imbalance, which is what PCOS would fall under. So first off, I wanted to start off with the fact that the 2023 guidelines have been updated. So we have always used the Rotterdam criteria to diagnose, and a dietitian will not diagnose PCOS. We could suspect it, but you really have to get your diagnosis from a doctor, whether that is an endocrinologist or it is a gynecologist. So what the doctor or the specialist is looking for is the presence of two of these symptoms, or what we call diagnostic criteria. So it's either you are showing clinical or biochemical signs of hyperandrogenism, so elevated androgens, whether that is extreme hair loss like alopecia, or you have hirsutism, the hair growth occurring in places we really don't want it to grow. Or it is that we have ovulatory dysfunction, and that could be we're not getting a period as we should, or we're having spotting throughout the cycle, or when it is we're having the cycle, it's extremely long. And then finally, what the doctor is looking for is via ultrasound to see that classic ring of pearls. Now, 2023 guidelines have now added to this the addition of anti-Müllerian hormone levels, which is a blood test that they do to see your egg reserve. And most women really wouldn't test this unless they were getting trouble with conceiving. But it is really a great diagnostic criteria we can use for women over 35 who haven't had a proper diagnosis yet. So what they're looking for is any value over 48 pico, we call it picomoles per liter, could be a potential sign of PCOS. And we found that 97% of women who have PCOS, they tend to have an anti-Müllerian or AMH level of 71 picomoles per liter. So that is the association we see there. So once you have two, you will get your diagnosis. So once we are diagnosed, we really have to get an assessment to see what is going on. And the management plan, which will follow your entire life cycle, it really wants to address a few things. So it wants to address reproductive health. So trying to reduce preconception risk factors to make sure that we are not being faced with issues such as, preterm miscarriage, etc. We want to make sure that we are getting a period consistently a month, even if fertility is not any question, to reduce the risk of endometrial cancer. We want to address the metabolic changes that can occur if PCOS is left uncontrolled. And that is going to be things like diabetes and cardiovascular disease, metabolic syndrome, increased adiposity, which then puts more strain on the organs. You have the dermatologic part of it, which has to do with the skin and the appearance. But that in turn with PCOS affects a woman's body image and affects their quality of life. So we always have to screen for emotional issues that can occur with PCOS, such as depression and elevated levels of anxiety. And then finally, looking at sleep, especially if that person in question suffers from a lot of insomnia, or even if they're getting sleep, they're consistently waking up on a morning feeling extremely fatigued and almost like they're dragging throughout the day until they get a little pick-me-up in energy later on in the day, which usually comes from a lot of processed carbs. So what is PCOS? So it's actually an endocrine disorder and not a reproductive disorder. We will most of the times get our diagnosis from the gynecologist, and it will affect our cycle and all of that and our ovaries. But it's really an endocrine, meaning it affects all the hormonal functions of the body. And it is why there are such varying symptoms for each and every person. But the characteristic feature is it tends to have an abnormal amount of androgens or male hormones. And I want to be clear that it is normal for us to have male hormones in our body as women. But when they become to an elevated level is when we have a problem. And we will have symptoms such as example, the hirsutism. So why we say cysts in the polycystic part is it describes that numerous cysts, or what the doctor will see on an ultrasound, those ring of pearls, and they're actually filled with fluid. Now, it's not that every woman has them, but it is one of the easiest ways that a doctor can tell. So what causes PCOS to manifest? And you will see from my little image there, well, how do you say you don't know professionally? We're still trying to figure it out. Millions are being pumped into research to figure out why. But we do know that if somebody in your family, female, has it, the likelihood of you having it is higher. And then, of course, if you have insulin resistance, and one of the first ways you kind of know you have it without doing a blood test is that telltale darkness that can occur around the neck or other parts of the body. And then it is if you start to put on more weight and get into that obesity kind of category. So these are some of the PCOS symptoms. And as I said before, they are wide spanning. So certain people will experience certain ones and certain people will experience others. So because it presents differently with every individual, the medical nutrition therapy, which is what a dietitian provides, needs to be tailored to each client. It's not like I could sit here and say every client or every person with PCOS needs to eat the diet called ABC. It will be different and has to be tailored to the client and what their root causes are. Because symptoms just don't manifest from anywhere. they're coming from something causing them in the first place. So these are some PCOS related changes. Now, PCOS is very complicated, lots of chemistry if I had to go through it in depth. So this is a simplified version. So firstly, you would have had the genetic predisposition for PCOS or the genetic predisposition for, let's say, insulin resistance. Now that, along with current lifestyle practices, how we're eating, what's our level of physical activity, if we are getting exposed to lots of endocrine disruptors, will all lead to hormonal changes. And these hormonal changes can cause a change in your androgen levels. And when the androgen levels change, that's when you will have those dermatologic issues showing up, the hirsutism and the acne. But the androgens will also affect the person's psychosocial, so how they feel about themselves, their self-worth, their self-image, self-conscious. Now, the androgens being increased along with elevated levels of insulin will cause disruption to the ovarian function and cause a change in the different hormone levels like estrogen. So therefore, we have the menstrual disturbances. And then because we have the elevated level of insulin, we have to worry about type 2 diabetes later on, which then likes to come with friends, the high cholesterol, the high blood pressure, and the metabolic syndrome. So let's talk about how insulin resistance affects the Caribbean, because unfortunately, there was not a lot of data on PCOS prevalence in the Caribbean. So because we know that left unchecked, insulin resistance can lead to diabetes, we have to look at where we stand amongst the world. So in the Americas, and this comes from CARPHA, diabetes was recorded as the 4th leading cause of death and disability in 2019. So North America, along with the Caribbean, are ranked 4th in the world. And this is why I harp on blood sugar control as much as I do, and why I like to specialize a lot in blood sugar management, diabetes, and PCOS, because we can turn this around. We just need the resources and the knowledge. I think lots of people are willing to make changes once they realize the changes can be realistic. So within the age bracket of 20 to 79 years old, the rate was 11.1%. And within the next few years, 2030 to 2045, it's expected to rise by 2%. And I mean, that's scary because it means that our health situation of our respective populations has the potential to get worse when we really want it to get better. So in 2019, Guyana was leading with the highest rate of death from diabetes, but Trinidad and Tobago, my country, was actually in the 3rd spot, with Haiti being at the 4th percent. So what is the diet and lifestyle recommendation? Well, basically, the new guidelines have said that they cannot specify one diet that fits all. While they are emphasizing the importance of a healthy lifestyle and importance of making sure you do your best with your diet, they are not saying that one particular diet or exercise way is better than others. So I'm not familiar if you all know, you're seeing things on social media now where, for instance, people with PCOS should not do very intense exercise. But again, we are saying that we can't say that because everybody is different. And for one person with PCOS, intense exercise like HIIT may work for them and make them feel better. But for somebody else, it may make them feel worse. So at the end of the day, we always want to weigh in mind the patient preferences are important. And it is why when you work with a dietitian, it is not a dictatorship. We're working together to decide how do we make your lifestyle better while still trying to adhere to the principles of what we need to do to make the condition more manageable. So let's talk about insulin resistance being one of the root causes of PCOS and one of the root causes that affects most people who have the condition. So around 65 to 70% of women with PCOS have insulin resistance. And we know from evidence that this high elevated level of the hormone insulin is what leads to the elevated levels of the male androgens. But what is insulin? So it's basically a hormone that helps your body utilize or absorb the sugars from the food we eat from our bloodstream. And you would get these sugars mainly from carbs. Now, insulin works almost like a key to attach the receptor on your cells to open up the glucose channel so that the sugar from the food can enter into the cell to give us energy. But persons with PCOS are building up insulin resistance from a long time before the symptoms start to manifest. So what happens is the pancreas has to produce more and more insulin to shuttle the sugar out of the bloodstream. And insulin does two things. So it will either help you use energy or it will help you store it as fat. So if what you're eating is not balanced or the portions are inappropriate, what happens is a lot of that energy is stored as fat, which is why it is very rare I meet somebody who is truly overeating with PCOS. Most are trying to eat as little as they possibly can, but they're still not seeing weight loss, or worse yet, they're seeing a gradual increase in weight the older that they get. So it's about 70 to 80% the risk of insulin resistance for those with PCOS. And more than half of those who are diagnosed with PCOS are likely to face type 2 diabetes by the time they are 40. So again, if it is we have this condition and we are living in the Caribbean where our rates of diabetes are so high, the risk is very high. And for women, how this affects us is that if, for instance, we are deciding to have children in life, we then have to worry about getting something such as gestational diabetes and then passing on that diabetes risk to the little one, because from the time you have gestational diabetes, the risk to the child is increased. And these are some of the symptoms of insulin resistance, but we're going to go through these on another slide. So what causes insulin resistance? I mean, it just doesn't come out of anywhere. And the first thing is going to be, of course, the genetic susceptibility. But genes are something that we can turn on. You can't really turn it off once it's been activated. So if we know we have the genetic susceptibility, therefore we can start to take in front, if you know what I mean. You know, we can actually do things to prevent us from getting where our genes potentially want to go. It can also be caused by chronic illness and inflammation. So inflammation is tied closely with PCOS. It is one of the other root causes. And of course, once we have things occurring in life, such as we are not sleeping good or something like that, you will have higher levels of inflammation along with a poor quality diet. The next thing would be excess consumption of carbs. And as we go on to the Caribbean diet part of this presentation, you'll see what I mean. So lack of quality sleep. Sleep is one of the most underrated ways of trying to control your blood sugar. I know we live in a constant ongoing world. We all have deadlines. We try to work as best as we possibly can, but you can't sacrifice your sleep. Too much sedentary activity, so sitting too much, lack of exercise, and then finally the accumulation of fat around the core, and then weight gain in itself. So I just wanted to explain this blood sugar chart. So in the middle, you're going to see the stable blood sugar range is from 80 milligrams per deciliter to 120. And during this stable blood sugar range, your body will release fat, protect the lean muscle, while helping to eliminate cravings and increase energy. And that's why this sweet spot is where we're trying to stay with our blood sugar, depending on what we eat. Now, because I know this question might come up, let's talk about fasting. So let's look under the 80 milligrams per deciliter line. Let's say I skipped a meal. I decided I didn't eat breakfast, or I tried to eat as little as possible, a breakfast about 100, 200 calories. Or I try to keep the carbs out totally, or I exercise in a fasted state. Your blood sugar would naturally drop. And the body is not going to decide, hey, let me burn fat for energy. It's going to burn your lean muscle instead. And that's not what we want, because that in turn will cause your basal metabolic rate or your metabolism to start to drop. So we are now existing on a lower amount of calories. Your body has adapted. So as a result, it's going to hold on and hold on to that fat. And that's what women's bodies are kind of evolved to do. We tend to store fat greater in levels than that of a man. Your energy levels will then crash. Cravings will increase. And those cravings tend to increase by the end of the day when we are the most sedentary. Now let's look what happens when I then have a rebound and I have too many calories per meal and my blood sugar spikes. That spiking of that blood sugar is now going to provoke an insulin spike, which is then storing body fat. So you would see here why blood sugar is so paramount to PCOS management. So what about the tests to determine insulin resistance? I suggest everyone with PCOS do these tests at least once for the year. This is how you know if you're doing a great job with your diet and your lifestyle changes, and how you are kind of keeping an eye out, making sure you don't just suddenly reach in diabetic territory overnight. So the first one is your fasting glucose, and you will do all of these tests fasted. No coffee, no tea before you go, and try not to move around too much, because let's say you get up and you decide to like clean your kitchen or do laundry before you go for these blood tests. All of that movement will lower the blood sugar and we won't get a true accurate measurement. So you can test your fasting blood sugar at home if you have a blood sugar monitor. And what you're looking for is a value under 100. If you're getting a value of as low as 102, it means that prediabetes has kind of started to set in. But most times, people who have insulin resistance, they tend to have normal blood glucose. Your HbA1c will tell you your blood sugar for the last 3 months, and you're looking for a value under 5.7. From the time it is 5.7 and above itself, we are now at insulin resistance level. But again, you can have a normal HbA1c and a normal fasting glucose. This is why I suggest persons also do their fasting insulin. It is often not one that you will get in the clinic, mainly because it's not available here in my country, in the public clinics, but you will often get it in like a private clinic if you go to it. And why it's important to do that is this helps to pick up the insulin resistance, because we utilize it along with the fasting glucose into other equations which help us really see your insulin resistance. And if it is, we can then decide to add in some helpful supplements, such as inositol, or if it calls for it, berberine, or the like. So these are some signs and symptoms of insulin resistance. So we have the ones that we can see, the acanthosis nigricans and the hirsutism, but we have ones that we can't see, which is why I said it's kind of invisible. The constant fatigue, the feelings of hunger, or the feelings to have something sweet after a meal, hard to lose weight, cravings for sugar, and all of these different things, including body pains that just seem random, all connected with the insulin resistance. So this is why blood sugar management is so important to managing PCOS, and it's because it's all linked. That insulin level being high, it can lead to elevated levels of high cholesterol, right? Which can then lead to things like non-alcoholic fatty liver disease, the accumulation of fat in the liver, elevated inflammation, hormonal imbalances, which can also include things like dysfunction with your thyroid, elevated androgen levels, gut dysbiosis, or an imbalance of the healthy bacteria in your gut, which then leads to increased levels of inflammation and insulin resistance in itself, type 2 diabetes, and that increased visceral or core fat accumulation. So let's talk about the Caribbean diet now. And we're going to talk about what are the characteristics of a Caribbean diet, apart from it being yummy. We know it's yummy, but let's talk about the nutrition part of it. So if you look at the pictures here, and I tried to get pictures from 3 different Caribbean islands, you're going to see one thing that we all have in common. We like our starch. Our starches or staples are our star. In every single one of those pictures, what is the most predominant item on the plate is the starch. The first one, the meat is on a bed. I believe that's cassava. The second one, there's a whole nice massive provision, and then we have the saltfish, and then finally we have a whole lot of rice. So our meals are carb or starch heavy, and that is kind of tied into our cultural history, where we needed to have heavy meals that would carry us through doing a lot more labor-intensive activities. But now, seeing as most of us are less physically active, these portions are now eaten in excess. Now, the second characteristic is some of our local favorites, such as things like the Jamaican patty or accra or doubles, they can be calorie dense. There's lots of calories in these items. For instance, a doubles has about 350 calories. And it's not like I'm ever going to tell you that you should cut something out of your diet. That's kind of unrealistic. We really want to practice moderation. If you're feeling for something, there is a way that you can eat it that will actually make the whole situation better. But what this is trying to tell you is you need to identify foods that are high in carbs and fats. None of these items here are just carbs alone. But when something is high in carbs and fat, it's a double energy situation because your body can use both to give you energy. So therefore, they become higher calorie, and they also taste so nice that it's kind of hard to stop at just one or two. So let's look at how we balance Caribbean meals. So the first thing I'm going to tell you is try to adjust the type of staple or starch used. And this comes down to choosing complex carbs versus simple carbs. And the difference between the two is that complex carbs contain fiber, whereas simple carbs do not. So the body is better able to break down simple carbs faster. Let's use the example of the soda. Let's say I was to drink that soda there. It's going to digest within anywhere from 15 minutes or less. And it's going to digest in a huge amount, provoking insulin. But compare that to, let's say, old-fashioned or rolled oats, which has fiber. So therefore, not only is it giving me more nutritional value, but it's going to slow the breakdown of those carbohydrates in the bloodstream. So it's going to be a nice slow increase, not provoking insulin to a drastic level. And therefore, the likelihood is higher of utilizing the oatmeal for energy versus the soda, which will be stored as fat. So some simple examples as it relates to our Caribbean diet is, let's say we are having a dish of rice, peas, like rice, chicken, let's say rice, peas, chicken, and salad. Instead of eating that rice as plain parboiled rice or white rice, we can choose brown rice. And if brown rice is not economical or available at that time for purchase, we can simply add vegetables to our rice, such as some of our dishes like okra and rice, bhaji and rice, Spanish rice, and the like. The same can be done with choosing, for example, white, whole wheat or multigrain bread versus white bread, and trying to make sure that the carbs you choose are complex, such as including peas and beans in the diet, vegetables, your whole grains like your oats, your breads, your corn, your tubers, which are a provision, and fruits. The next tip I have is that you're never to eat carbs by themselves. Carbs need friends. So you would see that if it is, for instance, we pair the green fig with the saltfish is our protein, and the salad provides fiber. The green fig also has fiber, and we would assume that the saltfish would have been cooked in a little bit of oil or fat. That is way more balanced. Of course, we're coming to portion, because if the whole plate is green fig with just some saltfish and some salad on the side, well, I mean, the saltfish can't literally carry all the carbs from the green fig. Another example here could be choosing whole wheat sada roti, which will be a fiber because it's made from a whole wheat grain. Your tomato choker, which is a vegetable, again, fiber, and the boiled eggs, which contains protein and fat. The same will go with the roasted breadfruit. The fish is the protein. The callaloo would have some coconut milk in it with the fat, and the breadfruit there is our complex carb. And then a simple example with a snack would be a pairing of fat and carb or fat and fiber. The nuts would be the fat, It does have a little protein, but the most dominant macronutrient would be fat. And the mango will be the fiber because it's a complex carb as it's a fruit. So whatever you are thinking of eating, I would always tell you, try to determine what is the carb first. And as I said, carbs are almost everything. You will just not get carbs in meat and fats. So once you identify what is your carb, you want to make sure that you're eating it alongside either protein. And if the protein is animal based, you're already getting fat with the protein. And if you don't want to pair it with protein, you would want to pair it with fat. So an example would be, let us say that you wanted to eat a piece of chocolate. You would try your best to make sure the chocolate is not super high in sugar. Choose dark chocolate if you can. But dark chocolate, even though it's better than regular chocolate, it's still a simple carbohydrate. It will digest too quickly. So I may not want to pair a boiled egg with a chocolate. That's a weird combination, even though it's a good source of protein. I might choose to have the nuts, a small portion of nuts providing fat, so that when I eat the chocolate, my blood sugar doesn't spike all over the place and provoke insulin. Next tip will be watch the portion size. So remember that first image I showed with all of that plate nice and packed out there with those heavy, nice portions? So we are trying to eat the same foods that we are accustomed to eating, but we are changing our plating method. And this is one of the easiest ways to control how much you're eating and then control your carb intake and make sure you're getting a balanced plate with carbs, protein, fat, fiber. I want you to always imagine that your plate has a line down the center. And that half of the plate is where we are accustomed putting our carbs. I want you to flip it and put your veg there. Now the veg can be cooked veg, like let's say roasted veg. It could be bhaji. It could be, for instance, salad if you have no other time. And you're going to put your carbohydrates, which should be complex, remember high fiber, in a quarter quadrant of the plate. Your protein will now go in a quarter quadrant of the plate. And you would see the little blue part in the middle is representing fat. And that is trying to tell you that sometimes we need to actually add fat to a plate because the amount of fat there is not enough. So I'll give you an example. Let's say I had half of my plate as salad. I had my quarter protein as being, let's say, a piece of grilled chicken. And I had my quarter of my carbs as, let's say, some boiled sweet potato. Because that meal really does not have a lot of fat, we didn't use any oil or anything. It might be useful for blood sugar balance and satiety as a whole to put some salad dressing on that salad or put a few slices of zabuka or avocado at the side for that healthy fat. My next tip would be to prep your starches in advance. So this is one of the reasons I'm a big fan of meal prepping. So I'm a fan of meal prepping for another reason too, and that is when you have PCOS and you're fighting fatigue, sometimes if the food is already cooked and it's in your fridge, it is easy to grab it and reheat it. There's no sitting down there and fighting with yourself trying to make a decision of what can I buy outside that's more or less balanced. Depending on where you live, that can be hard. So what I'm suggesting is that with your staples or your starches, things like your rice, your potatoes, your beans, your pastas, you cook it the night before. I know we like to eat our food hot as freshly as it is made, but when you do that, your body is better able to capture the carbohydrates. If we know that tomorrow we want to eat, let's say, potato salad for Sunday lunch, you'd want to boil those potatoes tonight. Cut them in little cubes and chill them in the fridge overnight so that tomorrow when you take it out and you make a potato salad, or let's say we didn't do potato salad, we did mashed potato. And I now take that mashed potato and reheat it the next day. Reheating it does not degrade the amount of resistant starch. It is retained. And there are other ways that we could add resistant starch to a meal. We can use, for instance, something like overnight oats. Adding those old-fashioned or roll oats to either a dairy milk or a milk high in protein, like unsweetened soy or unsweetened flax. We can also add things like pre-cooked or tin peas, which we have washed, to a salad. And adding the resistant starch will really help to make sure that if your blood sugars, especially if your fasting blood sugars or your postprandial, that's post-eating, are elevated, it will now bring it down without us having to further cut down the carb portions, which will then decrease the amount of dietary fiber that you are consuming. My next tip is you really want to eat your heavier meals during the earlier hours of the day. So this is tied into our circadian rhythm. And we know from evidence that women with PCOS tend to have circadian rhythm dysfunction. It's why it's so hard to sleep for some people and why others have very low levels of hunger during the day. So you really want to align your pattern of eating with your sleep and your wake cycle, because it will help to regulate your hormones and in turn improve the PCOS symptoms. So what this is trying to say is try to eat breakfast when you wake up. We should really have breakfast within 1 to 2 hours of waking, and it should not be coffee alone. Coffee alone is not breakfast. And you want to stagger your eating consistently throughout the day, every 3 to 5 hours, which means if you ate breakfast at 8 o'clock, it's probably time to start thinking about having lunch between 12 to 1. And you want to have your last meal or your last snack 2 to 3 hours before bed. We naturally fast overnight when we are sleeping. So it really does not make sense from a circadian rhythm standpoint for us to continue the fast in the morning. Just like that blood sugar chart I showed you, when we skip a meal, you're causing that provocation of your body wanting to break down your lean muscle and kind of hoard your fat. So with this approach, we are following the natural waking and sleep cycle. So your body should, with time, expect breakfast at a certain hour, get hungry and have the hunger cues occurring at lunch and dinner, and so on. And it's kind of a way of training your body to expect what is to happen at specific intervals throughout the day. So now we have in turn created better hormone balance to then make our PCOS better. And lastly, I think this is the last one. We want to add more fiber or vegetables to at least 2 main meals. So this kind of piggybacks on the healthy eating plate model, the model I showed you with the half of the plate veg. But what this is trying to really reiterate is the importance of fiber. So as I said, fiber helps with blood sugar balance, but it also helps control things like high cholesterol. So if we start adding more veggies to our meal, not only is it benefiting our health in that aspect, but it's also helping us naturally with weight management. And that is because the vegetables is adding bulk to the plate. The quarter quadrant of the carb and the quarter quadrant of the protein is not going to be enough to fill you up unless we fill up the plate with something else that is lower calorie. So while vegetables are lower calorie, they are also antioxidant rich. And again, even though we're not talking about inflammation in this particular presentation, inflammation can be increased by the quality of the diet. And if we're eating a diet that is processed high or nutrient poor, we are actually not eating enough antioxidants to control the free radicals, which can occur as a product of oxidative stress. Again, another complicated chemical reaction that occurs in the body. So try your best to add vegetables, whether they're cooked or they're salad, to at least 2 of your main meals. So for instance, it may be easier to do this at lunch and dinner. You can do this as well in breakfast by adding, let's say, spinach to a smoothie, a protein shake, or adding vegetables to eggs for that matter. But really try your best to make at least 2 main meals, half of the plate veg, which would at least help you to eat 4 servings of vegetables. So that is it for my presentation. So how about we get into some questions and some chatting now?
Thank you so much, Tessa, for that presentation. I was here making my little notes for myself, and I hope the others were too. So I'll turn over now to Kimet because she's moderating the chat for the Zoom. So she can go ahead and let us know if there have been any questions in the Zoom chat, followed by Alicia, who's moderating the Facebook chat. So Kimet, I hand over to you.
Thank you. And thank you, Tess, as well, for that wonderful presentation. I did learn a lot from it. We have about 2 questions, and I have a question of my own. The first question is, does PCOS cause your body to expel period blood longer?
It can for certain people, and it can cause shorter bleeds for others. So it's different. I mean, I have seen in my practice some women who will bleed longer than 7 days. Now, the issue or the risk with that is anemia. So if it is you realize that your cycles are getting very long or they're very painful, I do really suggest somebody go and speak with a gynecologist. But you want to do a CBC, a complete blood count, so you know where your blood levels are at. And if it is that you need to supplement or with iron, or if it is we need to eat a little bit more iron foods. So having PCOS myself, I have experienced anemia. And it was only when it became bad did I realize it was happening to me, because, sometimes we know things, but when life is going on, you just kind of forget until the symptoms start to manifest. So I would say definitely test just your bloods to make sure that you're not anemic. And if you are trending low on that value list, you really want to start to add in some supplementation.
I fully agree. Thanks for that. The next question is, having oats, flaxseed, hemp seed, pumpkin seed, sunflower seed, and chai seed with water for breakfast, is that good? The person, I assume, can't consume dairy.
So everything that person is eating is healthy, right? What they're eating is a lot of seeds. So while seeds will give you some protein, it's really giving you good quality fat. And while the oats is a complex carb. But what is missing there is a further addition of another protein source. So if they cannot consume dairy, I would tell them, what about using a non-dairy substitute, such as, for example, unsweetened soy milk or unsweetened flax milk? If that is not an option and they want to eat the oats just exactly as it is, maybe we need to add some eggs on the side. But the addition of a little bit more protein is really what would be missing.
Okay. The next one is, I was advised by a doctor to have my last meal at 6 p.m. and my first meal at 12 p.m. What are your thoughts on that?
Well, why? Is that when you're waking up, when you're going to sleep?
For Joanne, could you respond? Let us have a bit more understanding on that.
Hi.
Hello.
No, I'm usually up by maybe 6:30, but he advised that my last meal at 6, fasting wise, my last meal at 6 and my first meal would be at 12. So I am basically fasting for about 18 hours.
Yeah. All right. So, oftentimes doctors will make suggestions about diet, but really and truly, it should be directed to a dietitian. And that is because when we look at the studies, intermittent fasting has really been studied with men. And well, as women, we are not little men. So we respond differently to that prolonged fasting. And when you put the complications of PCOS in there, not just insulin resistance, but inflammation, which can be increased by fasting, that can also feed into hormonal imbalances, such as increased levels of cortisol, which then cause us to gain more weight. It really can backfire for us. Now, I'm not saying that it can't help you lose weight. Of course, intermittent fasting can help someone lose weight. It works on the concept of all diets, which is calorie restriction. But why not try to feed at set intervals throughout the day to keep the blood sugar stable, instead of starving all day and feeding into those blood sugar fluctuations, which can then lead the client or the patient to feel like they've given up at the end of the day when the cravings take over. So I personally do not see any evidence, no studies done on intermittent fasting being great for PCOS. In fact, the majority of them say be careful with it. If you're doing it, it should be for a short period of time, but really advise someone to eat more at set intervals. So trying to eat breakfast 1 to 2 hours after you wake up. So if you wake up at 6, try to eat by 8, and then have your normal meals every 3 to 5 hours throughout the day.
Okay, I hope that answers your question, Joanne. Priscilla asks, Can you use full cream milk with your overnight oats with flaxseed, chia seeds?
Yes, you can. That's perfect. Nothing is wrong with that.
Okay. All right, thank you. And for my question, it's kind of like a two-pronged question. So I usually don't eat a lot. The same
Mhm.
plate that you showed there, I'd probably
Right.
eat like half of that. So I'm wondering in terms of the portion size, I know it would probably look the same, but I'm just wondering how do I go about making portions out of that? Because I really do not eat much.
So your portions will be smaller than the half day
Really
plates.
small. Yeah.
Okay. That's fine, you know. I mean, everybody's portions are different. But what you're trying to make sure is that your portion of carbs are kind of lining up with your portion of fiber and your portion of
Mhm.
protein. So if your portions tend to be small, I mean, I have to ask, do you think that you're under eating a little bit? Or do you feel like you are fine where you are at? Like, have you had any intentional weight loss or anything like that recently?
Not particularly, no.
No?
For me, I think my system is a bit weird because I was gonna ask as well. You mentioned trying to eat within the first 2 hours, right? But I
Mm-hmm.
noticed like for me, if I wake up, let's say at 5:30, I don't have the urge to eat probably until maybe like 9:30,
Okay.
10.
Okay.
So right then and there, I'm already starting off I'm already on a bad start because, I'm starving myself literally, but
Mm-hmm.
not on purpose. It's just
Right.
that
I
I get
understand.
nauseous, yeah, and
So I
can't
was the
really
same
eat
way.
during that time.
I was the same way. And what actually helped me to get into the habit of breakfast
Mm-hmm.
was starting off with liquid breakfast. So that is what
Ah.
I did for many years. I would have done protein shakes just because they're easy, they require no
Mm-hmm.
work, and it was easy for me to drink it without feeling nauseated or not having a great appetite. But
Mm-hmm.
after many years of starting to eat breakfast slow like that, I mean, I'm still not a big, huge sit down and eat a huge breakfast person, but now you will start to feel hungry. You
Okay.
basically kind of retrain your metabolism, but you always want to eat according to what your body is telling you mindfully. So if you're not
Mm-hmm.
accustomed eating large portions, it's not like you need to increase your portions, but you just need to make sure that you are getting in protein, fiber, and fat with each meal to kind of keep it balanced.
Okay. All right. Great. Thank you for answering that.
Sure.
And we have two other questions. What are your thoughts on artificial sweeteners, particularly in diet sodas, Coke Zero, etc.?
So this is a loaded question, and that's because, there's a lot of back and forth on social. And the last study that I read, that was a compilation of studies, what they said basically is that this has not really been studied in humans. This is an animal study, and well, animal studies, we could form links, but we can't say it's an association. Furthermore, they have actually ranked alcohol above the aspartame and all of these other sugar alternatives. Now, at the end of the day, consuming real sugar has more of a risk as consuming the artificial sugar. But there is like a, what should I say? There is a give and take. So let's say that we consume artificial sugar, we are not getting the insulin spike to provoke the PCOS symptoms. But if we're consuming too much artificial sugar, whether it be stevia or it is erythritol or any of those things, it has the potential to disrupt your gut microbiome. That alive set of microorganisms in your stomach that can help us to maintain good health. So I really wouldn't want a person to be having diet soda or diet soft drinks or sugar alternatives in excess consumption. I would more want you to use it if you're real feeling for a soft drink and it's calling your name. Well, then in that situation, have the diet. But if you are drinking diet soft drinks, it should never exceed more than one for the day. So I hope that helps.
Thanks for that as well, because I know for some people with PCOS as well, they may have the craving for that little fizzy kind
Yeah.
of drink. So that is very important to know. Thanks for that. We have another one. Can you just eat legumes, proteins, and vegetables to cut out the rice and pasta? Is it I guess they say I wish to use inositol and berberine together. What are
Mm-hmm.
some supplements you would recommend?
So that was two questions, or that was one question?
I guess it's one.
Okay, so I forgot the first part when I heard inositol and berberine.
So they
Was to
said,
leave out the potato and stuff?
can you just eat legumes and protein and veg, but cut out the rice and pasta?
You can, because the legumes is a complex carb. I mean, it's going to give you fiber plus some protein. But I just don't want people to feel like they have to give up the starch because, as I said, most of our Caribbean food has starch in it. So if you're trying to avoid it, you'll be hard. You'll have a hard time. If it is, we try to watch how much we're consuming, it will be good because we can add some sweet potato or dashin or yam or whatever it is to that combo of the rice, the peas, and the vegetables. It's just making sure that the portion is not excessive because all of those good carbs that I just mentioned give us good quality energy. And what can actually happen is if we are not eating enough carbs, your body has the ability to take the protein and transform it into glucose. It's a process called gluconeogenesis. So it is one of the other reasons why we harp on balancing the plate. You never want to leave one out. But in the situation of the rice, the peas, and the veg, the peas is kind of the complex carbs. So we'd be technically not leaving anything out in that combo.
Okay, great. Good point. Thanks for that. I don't think we have any more questions from the Zoom side. So in that regard, I'll hand over to Alicia.
But before Alicia, there was a second part to the question, the inositol and berberine.
Yes. Right.
Oh,
okay.
yes. What supplements? Yeah, sorry about that.
Right. Well, it depends on what you need, right? So berberine has more risk, and we are really supposed to take liver tests every 3 months when you're using berberine to make sure it is not causing any contradictions. Whereas inositol, you can take it straight throughout your pregnancy without any issues. Inositol is also a form of a B vitamin, so it is quite natural. And just like with all B vitamins, if you consume in excess, well, you kind of urinate out the excess. But that is why I don't give everybody berberine. I would more give berberine in a case where somebody had very high levels of cholesterol, like high levels of triglycerides, because that is where its sweet spot is. Now, with any of these blood sugar sensitizers, I always tell people don't run and buy the supplement and just start taking it like that. Because if your blood sugars are not high enough, it can cause hypoglycemia, which is when the blood sugar goes under 70 milligrams per deciliter.
Okay, then. Thanks for that.
Okay, wonderful. On the Facebook side, Kellyanne asks, what is the difference between eating hot oatmeal versus overnight oats?
So that's a resistant starch. So when it is that we cook the oatmeal hot and fresh, the starch or the carbohydrates is more readily available. But when we choose to eat it overnight oats, it's not like either one is better than the other one. It's that the overnight oats has a higher level of resistant starch, so your blood sugar cannot rise as quickly. And it's the same concept why we want to cook pasta and potatoes and provision and rice the day before we intend to consume it.
Okay, wonderful. So since we have a Vinci group here, we eat a lot of farine. So
okay.
Cassava, and I noticed Africans, they call it gari, and they'll cook it, they'll do it more in the overnight oat kind of way. They'll soak it with cold milk overnight. So do you recommend doing that as opposed to for the cassava? And if we're eating cassava?
That could work. That could work. Or you can make your farine or your cassava the night before and just reheat it the next day. And it would still, both of those options would increase the resistance starch.
Okay. So that's it from the Facebook questions, but I'm a doula and I heard you talk about gestational diabetes. So I want to know if you have any more to say about gestational diabetes, any advice to avoid it if you're early on in your pregnancy and you haven't been diagnosed with it yet. And you have PCOS, obviously. PCOS in pregnancy, yeah.
Okay, so when you're pregnant and you have PCOS, try your best to eat as best as you possibly can within your financial and, of course, your physical means. And the reason for that is, as it said in the presentation, the risk of getting gestational diabetes is higher. And when you get GDM, you then are passing on the increased risk to the fetus. What can happen is called macrosomia, a very large baby. And I know people think very large babies are so cute, and yes, they are, but they pose higher risk to mom during delivery. And they also then themselves have an increased risk of type 2 diabetes. And if they are female, a 4 times risk of getting PCOS themselves.
Okay.
So you really want to make sure that when you're pregnant, we don't decide we're eating for 2. I know it is a time to feel confident and, you know, give in a little bit, but you don't want to give in to the point where you have massive weight gain throughout your first and your second trimester. You really want to make sure that you have your recommended weight gain as according to the doctor. So generally within about 20 to 25 pounds. And you really want to make sure that you are trying to eat your balanced diet, because you're trying to keep the blood sugars under control, but you're also influencing little ones' taste preferences as well. So if it is we're not exposing them in utero to different tastes and different foods, the likelihood of a picky eater is higher. So when you're pregnant, you're trying to do that, and you will listen to doctor recommendations as regard to exercise. If you were very active before pregnancy, you want to continue with that. But if you were not, this is not the time to go and start to beast it out in the gym. But it is also not an excuse to sit down on the couch and, like, you know, create baby whole day. It's about trying to still move, whether it be gentle walking or it be doing some kind of low intensity training on the bike or whatever it is. But those are the things that you could do to try. Now, if it is you are diagnosed with gestational, because I've had clients who have PCOS, but they're thin, and they were shocked that they end up getting GDM. It's not the end of the world. A dietitian can definitely help you get it under control. You don't have to give up fruit. You don't have to cut out the carbs, because cutting out carbs when you're growing a baby is not good for their development. So that is where working with a professional who can help you adjust your eating throughout the trimesters can really help make you feel empowered and not alone in the process, and help you see how you could still eat your cultural foods right through.
Wonderful. Thank you so much. Oh, okay. So we've got another comment. I noticed I have been skipping breakfast, that my sugars are elevated. Any recommendation on how to get it back down to regular levels? I'm currently injured, so no exercising at the moment. I recently started eating breakfast, but it's still elevated.
Okay, so I will ask that person what kind of breakfast you're eating that's making it elevated. For example, if it is that you're eating cereal and milk, your blood sugars will be elevated. The same thing will happen with pancakes, or let's say, for instance, having a sugary coffee. Even if you're having that sugary coffee with 1 egg and a slice of toast, what is wrong with all those breakfast examples is their main macronutrient is carbs. There is not protein and fat to help balance off the carbs. So that is what may be missing in her diet. As well, she may also look at sleep. If she has not slept well the night before, the morning blood sugars will automatically be high. So there are multiple factors into why something is going on. But my suggestion is take a food diary and write down what she's eating for 3 days, and really examine and look at it and see what is the amount of protein that she's having in that breakfast and what can be modified to it or added to it to make it improved.
Wonderful. Thank you. Kimet, I see you have a couple more.
Yes, we have 2 more questions in the Zoom. Thanks, Alyssa. So the first one is, what are some of the problems if glucose level is below 70 milligrams?
So that is hypoglycemia. And what can happen is extreme confusion, sweating, fainting. If it is extremely bad and we cannot bring back up the blood sugar with using something sweet, like let's say half a glass of fruit juice or soft drink, off to the hospital, we go for an IV in our arm. So it's just like if somebody has extremely high levels of blood sugar, it's dangerous to the system will shut down. So we're really trying to keep within that normal level. And it's why your body will try to always pull sugar that it has stored in the liver and the muscle to keep the blood sugar steady. But let's say we were fasting and we burnt out all of that stored glycogen. There's really no way for your body to rectify it in time. And that's why the blood sugar will fall.
Oh, okay. The second question is, apart from ultrasound, Should a person with PCOS do a blood test to identify which hormones are low? For example, the androgen, estrogen, progesterone, testosterone.
I mean, you can definitely do a full set of blood work. It can be expensive, so blood work should really be done on your symptoms. So for instance, I would send somebody to do a hormonal panel if they were struggling to conceive for a while, simply because I want to see if they are in the different stages of their cycle, such as follicular or ovulatory, if they're supposed to be. I would want to see their level of free testosterone if they're experiencing lots of hair fall or they have a lots of acne. You would want to see it as well. You would want to see another blood work, like let's say your HbA1c, if you're suspecting insulin resistance. So blood work really has to be identified based on the symptoms. Because I would say, especially if you're going into the realm of the fertility panels, like looking at your luteinizing hormone and your estradiol and all of these different complicated ones, that's when you want to wait for the doctor to ask you for those things, because you really want to sit down and get the full explanation there. And if you don't need it, it kind of would be a waste of money. You really want to target it to what is really bothering you.
Well
Okay,
said.
Sorry.
Go ahead.
I got a private message with a question. Somebody is asking about what supplements would you recommend for somebody with PCOS?
So again, it all depends. There are a whole lot of supplements. I would say almost like a whole slide's worth, right? So the most popular right now is inositol and berberine, but we also have many other types. So falling under supplements is vitamin D supplement. We have folate if somebody wants to try to conceive and they're preparing. And there's many others, Vitex, all of these different things, but everybody, something works for them better than something else. So until it is, I see a client, I talk with them, I look at their diet, I look at their lifestyle, I look at their blood work. I don't suggest any supplements until I see your bloods. Because even if something is available over the counter, what people don't realize is all supplements, even if natural, have a potential risk. So if it is you're not taking it with expert guidance, you're kind of taking things in your own hands, and you could be hurting yourself rather than helping yourself.
Okay, I have a question for myself.
Sure.
I had PCOS, and a few months ago, I had PCOS, endo, adeno, and PCOS. And a few months ago, I had a subtotal hysterectomy. But while with PCOS, I had insulin resistance. So I had the acanthosis, nigricans, and all of that. But now, in menopause, I still sort of feel the same way I was feeling while I still had the ovaries. So I don't know if my body is still experiencing that. And I've also noticed that I can still feel full and hungry at the same time. And I'm not sure
what's going on,
but how to adjust my meals, because I've done all of that, like trying to eat more veggies, trying to incorporate more veggies. But my problem is breakfast and dinner. I don't eat dinner because by the time I eat lunch, I feel full for the rest of the day, but still somehow feel hungry. And because I feel full, I don't want to eat. So it's just like a revolving cycle. And so I'm not eating dinner, and breakfast is just like, I do eat whole wheat bread, but it's just like with some peanut butter and maybe some herbal tea, or, if I'm feeling okay, I might drink something, some maybe cashew milk or almond milk, because I don't drink dairy. But it's missing the vegetables that you just talked about. So I was here making my little notes, but I don't feel full to eat a lot at breakfast time.
Right.
And my schedule at work is so tight that I can't get a little snack in between. So then lunch is usually sometimes between 2 and 5 o'clock, and then I don't eat dinner. So I don't know if I'm helping myself, harming myself. Weekends, I eat just like how you say, just like how you recommended. But the weekday, the work days, are hard,
a little bit more difficult.
A little more difficult to maneuver.
So I'm not sure if your feelings of feeling full and feeling hungry is still a consequence of the surgery. So it'll be a few months before your hormone cycles kind of go down. Now, even though the ovaries are removed, we have removed one area that produces androgens, but you still have your adrenal glands. They are right above the kidneys. So they will still produce androgens. And it's not like if removing the ovaries cures the PCOS. It's endocrine, so it's still there.
Yeah.
But the long-term goal will be to put yourself in a state of remission. So if we had insulin resistance then, we still have it now. It is just, it is more important now for us to get it under control. So the feelings of hunger that perpetuate even after eating is classic insulin resistance sign. And that is when I would tell somebody increase the protein, but you see you're already feeling full fast. So if it is that I tell you eat more protein, then you might need more than one meal for the whole day.
No.
Right? But the most important meal is your breakfast. It sets the tone for the day. So the breakfast you told me you are having of the peanut butter and the bread, it's not that it's bad, but the protein is missing. Peanut butter is not a substantial source of protein. It's a source of fat. So I would say better breakfast options for you would be eggs. So whether it be two whole eggs,
you don't
like eggs?
eggs.
What about protein? What about protein shakes?
I can do that.
Right? What about yogurt bowls?
I can do that.
So you see, there are different options that we could utilize. And if I had a vegetarian client, I would tell her do tofu scramble. And we could choose many different things. Chia seed pudding. We don't have to use dairy, but we could add either a vegan protein powder to the mix, or for instance, we can make it with some Greek yogurt, because yogurt generally has the lactose removed. So people who are lactose intolerant should be able to tolerate it. But it's about that. So even if it is that you don't have lunch until later on in the day because your stomach, what should I say? When we are digesting food, the stomach digestion rate can be different for everybody. So let's say yours is a little slower than normal. Even if we're eating later, your breakfast is so balanced that we know from studies, the potential for your blood sugars for your subsequent meals will intentionally be better. So you see like how you're not having dinner, we should try to have something small. When I'm not that hungry, sometimes for dinner is just a little bit of cheese and some whole grain crackers and a cup of tea. But I would not sit down and eat just the whole grain crackers with the tea alone, because I hear my own self in my brain saying protein and fat, right?
Right.
So that's what you're trying to do. So if, as I said, you are pairing the peanut butter, which is the fat with the carb, but you're not starting your day off with protein. And that is what is missing.
Okay. So I can add the protein shake, or just do the protein shake by itself.
Yeah, so you can simply mix the protein with water. Depends if your protein tastes nice. I like to buy the ones that taste nice, but low in added sugars. So you chug that first and then eat your peanut butter sandwich and talk done. It's simplified.
I can do that. Thank you so much.
No problem.
And before I go, there was another question on Facebook. Before we go back to the Zoom chat. There's more in the Zoom chat, but the other Facebook question is, can you give us some good breakfast dinner suggestions for persons who all have PCOS but also have high blood pressure?
So you said breakfast and dinner?
Dinner, yes, please.
Oh, dinner, not breakfast.
Breakfast and dinner. They ask for both.
Okay. So I would say breakfast protein pancakes. Now, lots of these things that I'm saying, I have a highlight on my Instagram. Tap on your recipe highlights. It's there for you. I have the full recipe and the full macro breakdown. So as I said, things like chia seed pudding or overnight oats. Once we're using yogurt, or we're using collagen powder, or we're using some kind of protein powder to add the protein, we could always do eggs, whether they're boiled eggs or it's frittata, or something like that. There's also cottage cheese if somebody could tolerate dairy. Cottage cheese is a great low-fat source of high-quality protein. And things go on like with the protein shake. So it's just all about your imagination. I do have other clients who like to eat food for breakfast. So it doesn't technically need to be breakfast food. It could be leftovers from dinner the night before that we're trying to repurpose so we don't have wastage. Now for dinner, I would always strive to have the dinner light. So you want to have your heavier meals throughout the bigger part of the day. So let's say that for breakfast, they all say you eat breakfast like a king, and you eat lunch like etc. etc. So it's the same principle. So try to keep your dinners uncomplicated, especially if you come from work exhausted. So this is when I keep dinners like soups, because you know you can cook a soup and leave it in the fridge for 3 days. Or I do salads, but I will not mix the salad and the meat together days in advance. It makes it go soggy fast. Or I do wraps, or I do sandwiches. Things like tuna salad, chicken salad. I mean, somebody with high blood pressure, saltfish is a no-no. But let's say we like saltfish and we have high blood pressure, we could take fish, steam it, and make it that same kind of bulgur way. Or for instance, we could use smoked herring with sandwich, or smoked herring with a piece of sada roti, but it must be whole wheat. And if it is, we could have added a little bit of lettuce or tomato and cucumber to that. That is how it balances it off. But I always suggest to people, think of your menu for the entire week. It's not like you need to cook it all at once. But at least if you sit down and draft out in your mind, well, this is kind of what I'm planning to eat Monday to Friday, then you have an idea of how your eating will go and you will able to be better prepared instead of just waking up in the morning, getting flustered, having no time to make anything, and then having to skip or just buy what you find.
Thank you. Can I have the questions in the Zoom chat?
Thank you for that. I just want to say you raise a good point with the preparing, because I'm thinking in advance, because that buy what you get, it could be a killer, especially when you're really busy and you're really hungry and you need to just get something.
Yeah.
Going to the questions we have here, someone says, my hunger cycle is the opposite. I am actually constantly hungry, but I don't feel for breakfast. Someone else, just a comment, says, we need you in SVG, to be honest. And
I want to come a day. It's on my bucket list.
Please do, please do. And the question is it okay to have eggs for every meal?
So no. And that is because eggs are naturally high in cholesterol. So it depends on if somebody has prediabetes or not. So from the time you are pre-diabetic and you have that elevated blood sugar level, we kind of want to watch how much dietary cholesterol we are eating. So a full-blown diabetic, we will only give 3 whole eggs for the day. But if somebody wanted to eat eggs for the whole day, I would say that you are limited to 3 whole eggs max, but unlimited egg whites. And you know, egg whites is more of an expensive protein source. So you can do it if you want to do it that way, but I do suggest adding in some other protein sources there, such as fish if you like, or tofu if you want to keep it vegetarian, just to kind of give you more of a variety.
Okay, thank you. Any more questions on the Facebook side?
No, we're good on Facebook.
Okay, and we're good on the Zoom as well.
What would you say to the person who said that they are constantly hungry but don't feel for breakfast? Would it be the same encouragement that you give to Kimet about starting with maybe the protein shakes and
Yeah, I mean, the whole fact that they're constantly hungry is the fact that they didn't eat the breakfast to begin with. That the hunger cravings are elevating later on in the day, which would then cause them to feel to eat. You never want to feel like a bottomless pit. So if it is that they start off slow at breakfast, just like I said, I started off with the protein shakes. I started off with fruit and yogurt. Those things were palatable. For me, it is harder to sit down and eat eggs and stuff unless I'm in the mood for it. But that is what will help control the later hunger happening later on in the day, because that excessive hunger in itself is a sign of insulin resistance.
Thank you so much. As we wind down, does anybody else have any other questions? We'll take them now as we come to a close.
I don't have any questions, but I'm hungry now for sure.
I'm hungry too. All this talking about food.
No food. And I know I'm in Brooklyn, so it's easier than some other places in America to get my West Indian food, but it's not as easy as when you're there. So now I'm gonna have to go searching.
When you answer the question about the ferrying, I was just thinking, because I have never had ferrying overnight, as in prepare like overnight oats. I've done overnight oats, but I have to try it to see how I feel about it because
West Africans do it that way.
it's so
Nigerians
interesting
and
to me.
Ghanaians, they call it gari, and they'll do it overnight, and they'll eat it with ground nuts. Is how they do it.
Really?
They eat it cold. I've never had it cold, but I see their little influencer videos and how they make it. It looks good, but I've never had it that way.
It's something to try because we just eat our farine either with
Milk.
avocado for those who like avocado, or milk for those of us who like milk. You just put it in the milk, you let it bloom a little, and then you eat it that way. But definitely I thought about the sugars and all of just so much things to think about. But with the overnight oats, it's okay to reheat in the morning.
Yeah, it's okay. Reheating does not degrade the resistant starch. But if you use, let's say, plantain flour or cassava flour as a flour substitute, and you bake that or heat that, the resistant starch is degraded in that form, but not in potatoes and pasta and peas and beans or any of those items.
Oh, so what would you recommend we make with the plantain flour and banana flour? Because I can get those things here, and I actually have some, I think it's banana flour right now in my cupboard. What are some recommendations for things I can make with it that would not degrade the resistance?
You can still
starch?
make you can't make something that won't degrade with it. You will have to leave it raw. And I have never left those particular flours raw. Those are things that I constantly will cook because I think it might grab your stomach. So once you are adding, because that in itself is a complex carb, it's a good form of starch. So once again, that let's say we're making a bread with it, like plantain, we have plantain flour here. So I might put with it still a little bit of whole wheat flour, a little bit of chia seeds, a little bit of flaxseed. So I'm still adding more fiber, but at the end of the day, it's still a good source. It's better than using white flour, for instance.
Okay. All right, that's good. Do we have any other questions? As somebody said, thank you for sharing your knowledge.
You're welcome.
We just want to take this time to thank you so much, Tessa, for accepting our invitation to join us. And I am hopeful that one day you may be able to run a clinic in St. Vincent because the ladies here love you. When we put up the flyer, we got a lot of messages about how much they love you, and they are so happy that you are going to be doing a session here. So hopefully one day you will get to come here and we can do something together. We just really want to thank you for your presentation and for taking the time out to answer our questions. We really, really, truly appreciate you.
You're welcome.
Thank you very much.
Thank you for having me.
Thank you. And thank you to everyone who joined us this evening, both here on Zoom and on Facebook. And we are looking forward to having you join us for our next session. Kimeta and Alicia, do you have anything to add before we close?
Thank you so much. I'm gonna be in your DMs.
Sure.
For all my doula clients. I learned a lot today because I'm usually the endo person. So PCOS is new frontiers for me. So I learned a lot.
Right.
Okay.
Okay.
From my end, just saying thank you so much for your wealth of knowledge. I'll continue to pre your page on Instagram and look out for the new content. Thanks again.
Great. You're welcome.
And for everyone who is looking for Tessa, she is on Instagram at trini.pcos.weightloss.rd. Sorry.
RD, yeah.
So look out for her on Instagram. There's always a lot of very informative content, and her highlight reel has a lot of good information. So trini.pcos.weightloss.rd. And you can follow us at She Is Lotus on Facebook and Instagram. Thank you everyone for joining us this evening, and have a wonderful rest of your evening. Good night, everybody.
Bye.
Bye.